Good evening, and dear committee members and distinguished guests. I am Benjamas Kammaroeng. I'm fourth-year medical student from Clinical Medical Education Center at Phrae Hospital. Today, I have the honor to present our dissertations developing a screening tool for methamphetamine use in pregnant women in Phrae hospitals. Thailand has been facing a persistent problem of escalating drug production since 2017. And a recent study showed that the prevalence of methamphetamine use amongst pregnant women was 3.3%. At Phrae Hospital, between 2021 and 2024, the total of 54 pregnant women tested positive for methamphetamine use in their urine. And of the pregnancies, methamphetamine use in pregnancy caused complications like premature birth, low birth weight, and developmental delays. A reliable screening tool could guide the treatment and prevent harm to both mother and infants. The objective of this research was to identify the key screening determinants and to develop a screening tool to predict methamphetamine use in pregnant women. This is a diagnostic prediction research and used a retrospective cross-sectional observation with determinant-based approach as design of data collections. There were 80 pregnant women who were tested for methamphetamine use between 2021 and 2024, and who did not have pre-existing conditions such as hypertension. The screening determinant for examples, history of substance use, age, education level, history of antenatal care. Statistical analysis was conducted using multivariable logistic regression to develop the screening model, which is performance evaluated using the area under ROC curve with 95% confidence intervals, and calibration plot were also used to assess the model accuracy. The results show that out of 80 pregnant women tested for methamphetamine, 54 or about 67% pregnant women test positive. The several potential determinants were identified as potential screening determinants as summarized in Table 1 on the poster, such as age more 25 years old. The odds ratio is 7.5 with 95% confidence interval between 1.51 to 44.06. Next, history of substance use. The odds ratio is 7.31 with 95% confidence interval between 1.82 to 35.63. And its sufficient ANC in the odds ratio about 16.94 with 95% confidence interval around 1.6 to 367. The area under the ROC curve was 89%, indicating good discriminations, but however, the model underestimated the risk when the predicted probability ranged from 70% to 65% and overestimated at risk at probability between 65 to 90%. And in conclusions, the screening tool demonstrates potential for identifying pregnant women at the high risk for methamphetamine use, but there are limitations due to the sample size and missing variables. Further research is needed to refine the model and improve the predictive accuracy. Thank you for everyone for your attention. If you have any question or suggestion, I welcome them now. Thank you.
Now you have 3 minutes for a questions and answers session.
I have about two questions. First, as I understand that your study population, all of them were tested with methamphetamines. It means that there are some criteria in your hospital to given these women to be tested with methamphetamine. could you explain what kind of criteria that pregnant women need to be tested for methamphetamine in your hospital?
Okay, thank you for question. In the delivery room at the Phrae hospital, there are not the tools or the guideline in the prior to screening methamphetamine use in among pregnant women, but certainly screening rely on the initial form history taking and observation, the healthcare and profession, and depend on experience, physician and medical staff. Is not the primary to screening.
See. So my second question is that I wonder how you are going to use your result in other population like the formal ANC patients that come to the ANC clinic.
I think is our research is not the sufficient to the primary screening methamphetamine use in the pregnant women, but it can initial screening first. Because the result of the study rely to the previous study before.